Uh-huh. Hello, dear colleagues. My name is Mynzhylky Berdikhojayev, and my assistant is Rawan Ayteli. We have patient 50 years old. Ayılmadı. He's stroke survival. He has hypertension and headaches, and in January, just a second, in January this year, patient had a hemorrhagic stroke in right hemisphere because of the hypertension, some dizziness, and all brain vessels are tortuous. Yes, it's also might be the because of the hypertension and because of the hypertension he could be tortuous, and he could be hypertensive because of tortuosity. The both could be the problem. And on the left side there is a slow flow invertebral artery, and we decided to treat this patient with the stenting of the vertebral artery. I think it's too much angulated. Let's take a look. Yes, the angulation looks too much. Yes, it's subocclusive, and it's better to place the stent. The artery diameter is nearly 3.8 millimeter, but we have short coil 275 by 9, and now we will do direct stenting with the Ultimaster Nagomi coronary stent, and then we will do balloon angioplasty. Okay. Just a second. Brisson. Так назад. I prefer to do it in a coronary way with the scopic control. Right. Максимум 26 verir. Контур. Buraya 28. Yes, I asked Juan to give it 28 atmosphere, but it's impossible. It's deflating by itself. Okay. And also on the right side, cavernous ICA is stenotic, but it's less than 50%. But the stroke was on the right hemisphere, and I think we will follow that stenosis, and only treatment will be in this territory. I'd say it should be very careful because the artery diameter is more than stent diameter. And Nagomi is possible to do overinflation. Okay. Inflator. That's per second. Yes, it's quite short, quite narrow. And now, yes, and Nagomi could be inflated till 4.5. Все clear. Alt atmosphere virus. At 6 atmosphere it will be 3. JG. Stop. So stop. Yes, and we can play with this versatility of the diameter. Now we inflated till 365. It's a 6 atmosphere. It's look like better. At the beginning it was nearly invisible V4 segment. Berdikhojayev шамал тағы 3.86 атмосфер. Егер напряжение болса тоқтайсың. I'm asking to give 8 atmosphere, but if there is any resistance, he needs to stop because of feeling the pressure is very important. Jet verirse. Medlin. Stop brother. Yes, and from cardiology experience, yesterday we had a good discussion in St. Petersburg, and our cardiology colleagues said it's very important to keep balloon for 20 minutes and then stent will apply on the wall of the artery. Okay, назад. Yes, but in brain, usually patients start TIA, that's why it's better to take it out earlier. Okay, let's see how it looked like. Proximal 3 centimeter, distal 3 centimeter of the Asahi Xeon Blue. It's a Xeon Blue wire. It's very soft, like narrow wires, and we're using this for the intracranial circulation. It's very helpful. Yes, and we are looking for those patients with the stenosis, and they usually developing stroke, and usually it's a disaster in posterior circulation. Wallenberg-Zaharchin syndrome and brainstem stroke is really disabling. Okay. I'm thinking about, okay, this was before, you already have seen, and this was before, no flow, this looked like occlusion, and now you can see the V4 segment is normal, and here is a subocclusive left side. Left ICA is a bit tortuous, but it's normal. There is a ACOM and small, okay, on the left side. Yes, the right vertebral looks normal because we can see the vertebral and basilar artery. I think no need to go to the right vertebral artery, and I have dilemma about this carotid artery. Maybe 4.5 by 12 millimeter stent will be okay in this location, yeah? Or we need to follow. What do you think, Rowan? What do you think? Should we treat or just observe? Okay, now patient on dual antiplatelet therapy. And this is after stenting. You can see nicely V4 segment and basilar. And patient will be on ticagrelor, and in 3 months we will do CT angiography, and we will see for any changes of this stenosis, and if it will grow, then we can place stent. Okay. Now I will ask to do expert CT. Üç мың istейсіз. 3000 гепарин istейсіз. вот эту картинку, которая снизу стоит. Абзал. Она стоит. Отлично. Okay, it's great. We could manage with the program. This is atherosclerosis, intracranial, but the brain is normal. Some artifacts from the CT, from the machine, but everything is look normal. This part looks after stroke. Yes, it's look like the tissue was changed. Okay. Yes, this is after bleeding. Okay, let's check. Можно общий вид поставить? Let's check the right side. For the possible aneurysms, but let's look normal. I don't see any aneurysm, that's why it was a hypertensive bleeding. And now we can finish the case and see you tomorrow. We will start Astana time 8 a.m. It will be in 9 hours. Have a good weekend, have a good Friday evening, enjoy. See you tomorrow. Thank you.